Good morning, everybody, and welcome to the session on developing authentic multimedia learning experiences for online classes. I am Vera Polikova-Norwood. I am Director of Distributed Learning at the College of Nursing, and this means that I work with faculty who teach their courses either entirely online or halfway online or in any combination of technology-based and face-to-face instruction. And with me this morning is Dr. Sue Heine, who is a faculty member at the College of Nursing, and she uses this instructional method to teach a course on nursing care of the older adults. This worked very well for us in our context with our students, and we hope that you will find something that you can take from this teaching method and apply to your teaching and learning context. Okay, so let us get started. And this is where we are with our programs, with our academic programs at the College of Nursing. Most of our offerings are indeed developed and delivered to students online. At the baccalaureate level, we have the Bachelor of Science in Nursing program for traditional on-campus undergraduate students. And we have a cohort in Columbia and also in Lancaster. Now, having a cohort of remote learners immediately puts us with the baccalaureate program in the distributed learning or distance education type setting. At the master's level, all our curricula are delivered online. And we are very happy and proud of our accomplishment. We are being recognized by U.S. News and World Report as #1 online graduate nursing program in the country. Yay. The Doctor of Nursing program, Doctor of Nursing Practice program is also delivered online, both at the master's level and the DNP level. The entire didactic portion is delivered online, and then students have to go to clinical agencies to do their practicums and field studies. But everything else is delivered online. And the PhD program is currently in the executive education format. Students make monthly visits to campus, but during COVID, these visits have been suspended and instead replaced by synchronous online meetings. So today, our learning objectives are, we hope that at the end of this session, you will be able to explain the benefits of using a continuing multimedia case study as a teaching and learning tool, the benefits for the students and the benefits for the instructor. We hope that you will be able to identify the technologies that can be used to create multimedia elements, describe the process of building a continuing multimedia case study, and you will also be able to evaluate the effectiveness in this teaching method in your particular teaching and learning context. So let's begin with part one. In part one, we will explain why a continuing multimedia case study, why we chose this method. So,
I'm just showing y'all a screenshot here of the course and the different parts of the course and how we do it, what the welcome is. We use this standard left-sided navigation on all of our courses that are online to help the students feel security and decrease anxiety about what the course is going to be about.
And the course, this is a fully online course. Now the students in Columbia who are taking this course are traditional undergraduate students. They are here on campus. But in our baccalaureate curriculum, selected courses are delivered online to help with scheduling problems. And so one of these courses that are delivered entirely online in the asynchronous format is nursing care of the older adult.
So what we know about nursing students, nurses like things hands-on, and so our students really enjoy their clinical skills. They feel like they are being a real nurse once they start to get doing clinical skills. So obviously that's a challenge in an online course. So we are challenged then to make this online course as real as possible, and to have as many clinical situations that the students can do or apply in their situations where they are actually in a clinical or where they may apply in real life in a family. So we're going to talk about, how we accomplish this kind of a situation.
Yes.
First of all, we developed a complex and detailed case study. So literally, I took the case study and I taped it around my room until we had 14 installments that reflected everything we wanted to do in the course. So first of all, we wanted real life problems. We wanted the students to be using instruments that they would use in a clinical situation and might be actually using in the situation where they are during the online program. And we wanted them to have tasks so that they, again, felt like they were a real nursing student. And the way that we did that is we used lots of multimedia to enhance their learning, making sure they're engaged. Another thing that we did through every episode within the case study, we developed a way to give the students feedback, because this feedback is really, really critical to their learning. And when we give them feedback, we're looking at how the students use the tool, what they learned from the tool, what they learned from whatever content there was that we were presenting. And we really push, because of some additional goals in the course, that we want to optimize patient care at every turn of events. And in this case study, the students are going to be moving through everything from a home visit to a rehab center visit to a palliative care situation. So because of that, we want them to learn as much patient care about that situation that they possibly can.
And as you can see, what we are getting at here is creating an experience which would make students feel that they are already practicing their chosen profession. This is a virtual field study of sorts. And so let's see what is actually happening in this continuing case study. Well, we start with episode 1, in which the students meet their patient, Mrs. Stone. And Mrs. Stone, in this episode, visits a large geriatric primary health care clinic. Now, the student is the nurse. So we say, you interview her about her health status, family, and life situation. And after the visit, you make an entry in the EHR. So this 2-line description is just a synopsis of the episode. The episode of the case study itself is presented in a Word document, and you can see this in the screen share, in the screenshot. The episode itself is shared with students as a Word document. So they have to open this Word document, read the episode, read the questions, and then begin to complete the tasks assigned to them. And when they are ready with the answers to the case study questions, then they come to the course again and use the link for the activity survey. This is where they submit the answers to the case study. And we set it up as a testing link so that the instructor can see the results for individual students and also in the aggregated format. This allows the instructor to see how the class is performing as a group. And this first episode includes a video in which the nurse, which is portrayed by Sue, is meeting a patient. It's a very short 3-minute video, but it gives enough visual information so that students can analyze it and adequately answer the questions. And then next week, Mrs. Stone again visits the primary care clinic. This time, she shows up with a bag full of medications. And the students, again, have to view a short video and then figure out how to ensure the patient's safety with the multiple medications that their patient is taking. And again, the same thing happens here. The case study itself is presented to students in a Word document. They have to open the document, read the case study, see what the questions are, view the video. This case study also includes an instrument to assess patient health literacy, and they have to compare the results from the instrument with what they observe in the video. Are they congruent? They are also prompted to go back and review the previous video to see if their observations from the second video are the same as what they observed in the first video. So they are putting more and more of the patient's story together. And then when they have prepared their thoughtful answers to the case study questions, they come back to the course and submit the answers through the testing link. Okay? And the story continues. So back to you.
So what we're doing with this then is exposing them to as much of the content as we possibly can that's pertinent to an older adult and taking care of an older adult in a lot of different situations. So we want them to be able to compare whether or not what they are seeing in older adults in a home visit or in the rehab center or in the hospital are physiological changes that are normal or some kind of illness. So we really want the students to be able to sort that out and to identify, again, in that at the end after when they're doing the survey activity, to identify what they might be seeing or learning about the patient. So is the vision problem she's having some, major health problem, or is that a normal part of aging? Then we go with subsequent video, subsequent episodes. They are learning different things about her, and they are changing roles, because it's really important that, because we are talking about transitions of care, which are very normal for the older adult, and we want them to get that sense. We also want them to get the sense of what different roles the nurse might have, depending on if she's in the hospital, if she's in the geriatric clinic, if she's at home with the patient. So we go on each, then we build information about Mrs. Stone, so that Mrs. Stone's story and everything that's happening to her is elucidated to the students in short bursts, but hopefully compelling bursts to help them absorb what we want them to do. So they learn about Mrs. Stone's COPD, in chronic obstructive lung disease in the 4th episode. Then in the 5th episode, they actually go to her home and do a safety assessment. They see a short video of a real home that one of the faculty made, and they identify, then the students, after they view that, they look at what is the problem or the problems in the home, or what's the good things in the home, what does the nurse need to suggest be done differently. And then, for example, and they're using a CDC document that's like a checklist. So again, it'd be very real, something a home nurse would do. And they are also then identifying, and oftentimes when I talk with them, they will choose the most expensive safety measure that could be done in the home. So they may, for example, choose putting in a ramp. That is not always the best solution. It's particularly not a cheap solution. And we encourage them to think about common things that can be done. Then finally, we get more of an introduction. Now, in the initial introduction, we learn about Mrs. Stone. We learn that her children are biracial. Her husband was African American. And so now he comes into the picture, and we learn a little bit more about him and what is going on. So they get a chance in this episode to assess for the potential for elder abuse. And we make it again as real as possible. And then when I do the discussion video at the beginning of the next week, we talk about each time, what they identified correctly, what they did not, what they would need to work on, what might be an alternative. Then we also, thought about, because there are different ways, of course, of doing case studies. Why do we want it to be continuing? Why did we want to build one thing on the other? Well, I feel like, because story is one of my major interests, first of all, that people really learn through story, and they absorb emotional information as well as content through story. And so we're able to pull out, with the use of a continuing case study, first, the level of complexity. So you've already seen in the previous slide where we said we're building on each of these concepts. Then you also can see how we're adding. So we talked about safety in session 2, but then we've added safety again. So safety becomes a theme because safety is a major problem in older adults. We add it again when we talk about the son and elder abuse. So we're really able to connect these concepts and reinforce them. We can also show easily with this continuing thing clinical issues. So her vision, her environment. We can show psychological issues. She's scared. She's having problems at home. She's worried about living alone. Her social situation, she's got a limited income. She's not got as many friends as she used to because she can't go out of the home very much. And we help the students then to see how a patient obviously we're doing this over a semester, but really these changes could occur over months and months or even a year, say if they're coming back to the geriatric clinic, so the students can see how these changes might occur, what might happen when a certain change, if the patient falls, if they have to have a hip replacement, they have to go to rehab. And my big thing is I don't want you just to know. So I don't want facts from students. What I want from students is critical thinking, because that is what helps them pass their in-class exam, but it also is what makes them to be a expert nurse when they get into the clinical situation. So I want them to think about not just the surface, but more in-depth thinking. And I want them to start using their judgment skills, so what is going on. Also, because it's critically important that nurses develop healthy relationships and connect emotionally with their patients. I wanted us to do that using, Vera and I, using this story and see if they could, in fact, develop empathy and develop these critical thinking skills through the story. Also, the reason we watch our favorite soap opera or our favorite murder mystery every week, or whatever it may be watching, we watch it because if we get engaged and interested. If they take off a character, we were really sad, or we were even mad. So we want the same thing in the students. We want them to be interested, engaged, and it's almost like the next week, what's going to happen on the show.
So we have 14 participation activities, 14 episodes of the case study, and collectively they give students 30% of the course grade. Now, credit is given for timely completion. Please notice that we are not grading it stringently. Credit is simply given for timely completion. 30% of the course grade, just do it and you get it. Why? Now let's think about our students. This is their first semester in the upper division. This is one of the first nursing courses that they are taking. And we are having them do such complex nursing tasks. So they're making mistakes. And it's natural at this stage to make mistakes. So we know that students cannot perform each task perfectly. So by just giving credit for timely completion, we reduce stress for learners. This is not a clinical course. This is not a stressful course. But we want students to learn by performing an authentic task, being proud of it, and feeling excited. Pretty much all of the questions on the case studies are open-ended, and there are no right or wrong answers. Obviously, some answers are better than others. But if students show an earnest effort at figuring out the situation and arriving at the best solution for their patient, that's fine. That's exactly what we want them to do. Also, taking this approach of just encouraging participation and do your best, show us your best thinking, it encourages students to open up and describe their thinking process. So the instructor actually sees how the students think, and then she can take that information and provide needed correction. Giving credit for completion only saves the faculty member a lot of time. You don't have to agonize over, is this an A- or a B+ type work? When we save time in grading, this time can then be used to provide feedback. Students need feedback, and more feedback on how they are performing. So this is where we want the instructor to spend their time rather than in figuring out a numerical grade. And this feedback motivates students to improve and do a better job next time. And we actually do see that happen as the semester unfolds. They get so into the story, and they really do want to do their best for their patient. So this low stakes approach actually works very well. And there's more and more in literature now about creating low stakes assessments for students which enable practice and enable feedback from the faculty. In the second part of this session, we will talk about what it is that students do actually learn. So, Sue, will you take it from here?
So what the students are learning over 4 weeks is they are making assessments of the patient at different points in care. Remember, they might be making a home health assessment, a literacy assessment. And again, in doing that, we're not just asking them, to make it up out of the blue. We are including, as a part of the course, the standard nursing tools that they might use in the situation to make that assessment. They are able to observe the patient in stressful situations through both narrative and videos. So they, really can get into what's going on. We always want them to identify patient problems and needs, and we want them, again, to go beyond surface, to kind of listen for the meta needs, if you will. I mentioned already that throughout, if they're doing any teaching, we expect them to use healthcare literacy principles so that the patients are being able to understand what they're told. They're looking at and demonstrating through our videos and our interactions effective communication techniques. This is one of the most important things that nurses need when they begin practice, and it's one of the areas that we've learned is hard for students. So we really interject these, talking to other nurses, talking to patients, talking to physicians. All of those are critical, and we are building in what they might do there, and even the written communication techniques. So when we have them write a nursing note in the electronic health record that we're evaluating, we're thinking about what is it they're communicating. When we have them present to the through the activity through the team in rehab, based on the assessment that they've seen in the video, we want to be sure and help them to figure out how would they say. It's really hard for beginners to recommend an intervention even if they know what the intervention should be. So we want them to practice that, even if it is writing it out. It still is a type of practice in advance of doing it for real. We present them with multiple assessment forms. So everything from skin care assessment forms, skin tear assessments, things that are very pertinent to the older adult, a nutrition assessment. We have them calculate the patient's BMI, and so that they can use that to think about what kind of, is the patient malnourished or not, and to what extent. So everything that we are having them do is literally what they would do in a nursing situation. We want them to be able to advocate for the patient. So especially in the issue of the potential elder abuse, what is it they're advocating for? What are the differences? We also want them to know what are community resources that the patient can be referred to. Now, they'll get community resources in another course, but they need some beginning experience, and we want to give it to them here. In coaching, mentoring, and challenging and encouraging. So I do think that it's really important. I I do a video every Monday that is a review of the participation activities, the things that they have responded to. Occasionally I'll mention something about quizzes, but typically it is related to their responses to the assessments that we've asked them to do, to the nursing interventions that we've asked them to list, to various parts, even the sharing of their own experience. If they've not seen a patient with, say, pain, then we would like for them to share that. And, you know, I'm not trying to tell them what they're doing wrong. In fact, I try to pull from the responses and create a Word document that I show on the screen, the great responses they've done. So students have an opportunity to learn, oh, she thought my response was so good, she's now showing it to other students. So that is a way of mentoring and of coaching and challenging and encouraging. I will write notes on their participation activities there's even a simple note of that was a great response. Unfortunately, I also have to do a response like, this was not adequate. I don't have to do that usually but once, because they don't want to have to redo the thing, but I can give the students then that feedback that is so important to them. And you can see here, this one is on communication. So what were some of the verbal and nonverbal messages that Mrs. Stone was communicating about herself? You know, did the students pick up on it? Then if this is a great example, I can just copy paste it to the Word document and it'll show up on my Monday video. But it'll also see that the student, if they go into the grade book, will have had a response from me. Now, sometimes I make really long responses, but a lot of times, especially as the semester goes on, I just use a 1 or 2 word response. Again, unless the student has not made a good attempt to answer the question.
And this is how we make sure that the students know and understand that the instructor is looking at everybody's contributions. And there's a requirement for students to submit thoughtful answers. So if they submit something that does not show an adequate effort, then what happens?
I will reset it, send them a message that they, you know, are going to have to redo the assignment. And as I said, it doesn't usually take but one message for them to really elaborate then in the correct way. And I don't want super, super long answers. This is, you know, a great example of answers here. But I do want them to be thoughtful, and I do want them to think about the issues that were brought up in that episode that week. And in some cases, it's even adding in. So it's cumulative issues. So here we're seeing what are the connections and reflections that come about from the, and that we ask them to do through the case study. So they're learning a lot of things. So we ask them to kind of keep up a real simple, not a grading thing, but they need to keep up a problem list. Because this way then they begin to see all of the different things that could potentially be going on with the patient based on the different topics of each week. So whether or not we're talking about COPD and we're doing a very physiological, what was her breathing, what were her oxygen saturation levels, those kinds of things, to was she eating right, was she talking to her neighbor, etc. So all of those things come up there, and we want them to really see and relate that to what they are seeing in their own clinical area and apply that to the clinical area. So we will both ask them, you know, have you in your clinical area, what is the fall precautions? So whatever clinical area they in, and with as many students as we have, they are going to be all across the spectrum from in the hospital to nursing homes. So we want them to be able to figure out the how what they are learning in the course applies to their patients. And so we ask questions about that. We also, I really think that what makes a great nurse, and I think there's evidence for this, is letting your own personal experiences broaden your knowledge and understanding of the experience. So if the students have not seen dementia in the clinical area because they've been in acute surgical, for example, then they probably have, even though they're very young, they've probably seen it in parents or grandparents. Some of our students work as nursing techs or nursing assistants, so they may have seen it there. So I want them to bring out the things that they've learned in real life. What's it like to be able to have enormous amounts of pain and people not listen to it? So we also want to talk about stereotypes. I always tell the students, I'm teaching this course because I'm oldest faculty in the college, but I do pick up all through the semester. In addition, we have them do a little quiz on, wait a minute, you know, just because the patient is doing so-and-so does not mean that, you know, she is not capable of making her own decisions, or just, you know, other things like that. We want the students to think about their own future and their mortality, because self-awareness is critical in a nurse, and that self-awareness means that they're taking care of aging and dying patients. To be self-aware about that, they need to think about their own mortality, and we ask them to write a living will, because that's one of the things that really brings it up, because many of them will say, I never thought about that. We do want them to begin to develop a professional value system and to develop those, I've already mentioned the metacognitive skills. So not just the obvious, but the next level of thinking about and developing critical thinking.
Okay, and again, let us stop and see if we have any questions or comments in the chat. So we have explained the learning side of things, what it is that the students are learning from this almost soap opera-like experience. You mentioned having students keep patient problems throughout the case study. Do you use an electronic notebook or something similar in the course to help students keep track? So would you explain how students keep up with the problem list?
Yes, we really do it very simple. We suggest they just create a Word document and save it along with the other course content that they're doing, and add to the Word document as the weeks go by. I think simple can be, you know, really one of the best approaches, and I just want them to look at that document. They don't have to do anything with it. They don't submit the document. I did that initially as I worked on the case study, so I knew that it would be useful for the students to do that.
And the questions that prompt students to do this begin with, based on Mrs. Stone's present and past medical history, what would you recommend, or what is her status right now? So then the students have to go to the list and see how the story builds, what else they need to take care of. Okay, well then let us move on, and part 3 is about building the case study, the process and the technology. Now we are getting into the how-tos on the instructor end of things. So what are the multimedia elements in this multimedia case study? We keep everything very simple. We used images just to help students identify the clinical context, whether it's happening in a primary care clinic or in a hospital or in a patient's home. Videos. We do not have a huge number of videos, so we have 4 or 5, I think, right? So, and we only use videos for those episodes when we need students to observe the patient or the patient environment and make a judgment based on that observation. So for those episodes, having a video is critical. If it's not critical, then there's no video. We use lots of web resources and PDF documents, forms, instruments, again, to enable authentic nursing tasks. So, for example, with the frailty assessment, they look at the frailty assessment instrument, then they have to apply it to Mrs. Stone based on her present and past medical history. They have to review previous episodes because that medical history comes into play here, and then they make a determination. All multimedia elements were made accessible, so if it's an image, we provide an alternative text. If it's a video, we provide either closed captions or a transcript. Now, the technology. Again, we are trying to keep everything very simple, just enable the task and not go overboard with fancy things. So everything is on Blackboard. The case study episodes are presented in a Word document. We use personal digital devices to take pictures and sometimes to produce a video. There's also a really lovely clinical simulation lab in the College of Nursing, which has a nice setup for recording video. So we use the camcorder available there to record videos of nurse-patient interactions. Video files are short, and they're posted to either Vimeo or YouTube. Since this case study was developed over several years and different people worked on it, some videos are on YouTube, some videos are on Vimeo. Those are just video sharing platforms. And of course, a computer with a webcam. And Sue uses Blackboard Collaborate Ultra to record instructor feedback. So again, technologies are simple. Everybody has access to them. If you are interested in applying this approach and develop your own continuing multimedia case study, then we would recommend that you approach it as a long-term project. Don't try to rush and create, 10 episodes for the next semester. We would suggest that you start with the story. Find a good story with real life characters and real life actions, or write your own. Determine a role for the student. For the students. In our context, the students become the nurse in each episode. And as the setting changes, the students explore different roles that nurses can perform, which is a very valuable aspect of this whole thing. And you can start small with just an outline of your story. This is where it's set. This is who the characters are. This is what happens in this episode and then the next episode. And start with just 2 or 3 episodes. Keeping the same characters, maybe changing what they do and also changing the setting if necessary. Then every semester you can start adding more episodes and more multimedia elements. To produce those videos that show interactions or show a character performing a real-life task, well, collaborate with colleagues. And you need ideas, and you need actors for your videos. You also want to portray diversity of situations and diversity of real life characters. So work with the colleagues. And then keep track of how your story develops. This is really important. It just sounds so elementary, but this is really important. We didn't start with a master plan, and then when Sue was taking over the course, the existing case study episodes were a bit confusing. So we had to sit down and put everything on the timeline and then make corrections, rewrite some of the episodes, and now we have a beautiful master plan document that shows how the episodes flow, how the patient story changes, and what multimedia elements which each episode has. But if you start with the right plan, it's probably easier it's going to be easier to keep up with the story details and how it develops. And then when you write your questions for the students, just base them on authentic tasks and include reflection questions so that you can stitch everything together and get more learning out of it. Okay, so we are in Nursing 313, Nursing Care of the Older Adult. This is the course for the fall 2020 semester. This course is not currently offered in the, to the students, so we are looking at the fall semester course. The case study itself is presented in the course weekly guides, and these are the guides for each week of the semester. So let's take a look at week 1. And week 1 is kind of long on instructions because this is the week when students are getting started in the course. So now we come to learning activity number 6, complete participation activity 1. You are going to meet a patient with whom you will be working this entire semester. The title of the episode is Meeting Mrs. Stone. Here's a synopsis. Mrs. Stone visits a large geriatric primary care clinic. You interview her about her healthcare status, family and life situation, and after the visit, you make an entry to the EHR. Now, instructions to the students. Read the case study document. Pay attention to details. You have a role to perform. View the video. Carefully think through the case study questions. Prepare thoughtful answers. Type or write down your answers. Submit your answers through the participation activity 1 activity survey link below, and it's due at 8 p.m. on Sunday. So students have a whole week to complete this activity. And they have to scroll a little down. Okay, and now this is participation activity 1, meeting Mrs. Stone. This is the attachment, the Word document. And now let me, okay, as you can see, here's the picture of the geriatric primary care clinic. Then students have to view this video. And the the transcript. We provided them with the transcript for the video. And then they have to answer the questions. Oh, okay. So let's see what we are asking them to do. So after viewing the video, list several of the verbal and non-verbal messages Mrs. Stone is communicating about her health and well-being. From the list above, identify which of these messages could indicate that Mrs. Stone has experienced stereotypes about the elderly. And question number 3, ask students write a short encounter note for the electronic medical record that alerts the healthcare provider to concerns which should be addressed in this visit. So this is what the students work from. Then they can take all the time they want within week 1 to find or produce good, thoughtful answers to these questions. Okay, so would you like to add something, add anything while we are looking at this case study?
I don't think so. I mean, I think the first week we do try to keep it simple and shorter, because again, they're beginning nurses. They won't have had how to do an MAR, so we're not really looking at a perfect recording. We're just getting them to have the experience of writing, expressing themselves in writing what the patient's situation is.
Let me show you how some of the episodes are enriched with conversations, how we make them actually interactive. It's just playing a little trick with Blackboard. We are now in the week during which students explore pain and comfort. And here's the participation activity for this week. Mrs. Stone's pain, can you help? Mrs. Stone is now in a rehabilitation center, and this episode follows her admission to the hospital. In the hospital, she suffers a fall, and now she is in a rehabilitation center. You are her nurse. The healthcare team asks you to conduct Mrs. Stone's pain assessment and report your findings and recommendations to them. Now, the instructions for this case study are read the case study document, explore all included resources, complete pain assessment, a conversation with Mrs. Stone. And for this, students have only one attempt. They have 20 minutes to complete. And they are instructed to take detailed notes of their assessment findings. Carefully think through the case study questions, prepare your answers, and submit through the link below. Okay, so we are scrolling down to find the case study documents. Here's the case study document, which includes this conversation. This conversation is necessary because in this case study, something is going on. The healthcare team does not entirely believe the patient's story. They don't think that Mrs. Stone is experiencing as much pain as she is reporting. So what's going on? They charge the nurse, and remember, the students are in this role. So the healthcare team asks the nurse to investigate, maybe use a different pain instrument, and then report back to them. So let's go through the conversation with Mrs. Stone. Okay. So you enter Mrs. Stone's room and greet her with a smile. You say, "Good afternoon, Mrs. Stone. I came to check on you and especially wanted to find out about your pain." Mrs. Stone says, "I told you this morning my pain is an 8 and that has not changed. So which of the following decisions would be more appropriate for you to make at this point? Your first choice is you decide that Mrs. Stone is not really experiencing this much pain, that she is faking her pain to get an opioid ordered for her. You will tell the team to leave her pain medication as ordered. Your second choice is you decide that pain is what the patient says it is and that Mrs. Stone is in a great deal of pain. That will be your report to the team. Or the third choice, you decide that pain is what the patient says it is and that Mrs. Stone is in a great deal of pain, but her description does not help decide on a treatment plan. You will ask more questions to learn specific details of her pain. So, what would you choose? What decision do you make at this point? And I cannot see the chat room, but would the participants please tell us which action the students should choose this at number 1, number 2, and number 3? Yes, the last option. And so there are six questions of this nature in this episode. So students have to complete this entire conversation with Mrs. Stone and take notes pretty much from every question. And this is how they collect information about Mrs. Stone's pain. And then they will need to prepare a report to the healthcare team about Mrs. Stone's pain status and what they think should be done. At this point, do we have any questions in the chat? Okay, Sue, could you take that question? Can you speak about the percentage of content in relation to the issue of elder abuse and the role of the nurse in this issue? Well, we have one episode on elder abuse.
And the students perform a standard assessment on that. They read the chapter in the book that has to do with elder abuse and safety. There is a lecture that's part of that week that covers elder abuse and safety. So they will have gotten content in 3 different places if they do as instructed by the assignment. And then anything that I feel like is misunderstood, so they will get both abuse and neglect in those lectures and in the as well as some general safety like the neighborhoods they live in, crime, etc. Then there'll be that content in their chapter, and then there'll be the content that accompanies the assessment, and they'll assess 5 different kinds of elder abuse. So, financial, physical, emotional, etc. So it's only one in one of the 14 episodes, but it's covered in 3 ways.
Yes, but the students work with an instrument which allows them to analyze the situation, determine what evidence they have, and how to report it. Okay, so now then move on to part 4, which is looking at the effectiveness of this approach. And Sue, back to you.
So if you remember, I said critical thinking was critically important. And so we asked them some generic questions about their understanding from the course, what they learned, etc. This, I think, is a really good example of the student realizing that they have developed critical thinking through the course. That helps them understand their patient, pulling on previous interactions, the importance of holistic care, I enjoyed the opportunity to interact with Mrs. Stone in the hospital. Now remember, this interaction is all just in the story. Help them visualize the social determinants of health, not to blame Mrs. Stone for her COPD or her hypertension, helping her figure out ways. So an excellent example of the student figuring out. Overall, I believe I've refined my critical thinking when it comes to using the nursing process and thinking about the patient holistically. Then for empathy, remember we also said this was a critical course goal. And so the students develop a relationship with this character in the story, this fake patient. At the beginning of the semester, she was a stranger, and the student was just doing their job, and then they get more interested in her. My perception changed from just taking care of a patient to learning how to provide holistic care. In the beginning, I wanted to fix everything, which we know is not possible, and I realized that I need to focus on issues and treat things as they came along. And then I love this part because the students really do begin to feel that Mrs. Stone is real. It might sound corny, but I was kind of sad when I realized this was our last week with Mrs. Stone. We do not have Mrs. Stone die. We do send her to palliative care, and we do have comments from the students about, I'm so glad you didn't let Mrs. Stone die, and how sad they were and how important she was. So here again, remember, we want this to cross over from this course to others, the students reporting that. And I learned about concerns that a lot of older adults have. And then even though those are 2-minute videos, they learned about interacting with the patients. It prepared them for interacting with the patients in the rehab center. So don't discount the value of a very quick, short video for role modeling to the students their appropriate interaction and behavior. Some perspective on this as a faculty is providing feedback does take time and effort. You do have to think about what the students wrote. The participation activities as a low-stakes assessment and field feedback really do build trust and create student-instructor dialogue. If students have concerns, they do email me afterwards or put something on the discussion board. It encourages students to reflect across the curriculum. I do develop a general outline for feedback and customize it as needed because it sort of almost is like thematic analysis and qualitative research. And so you can sort of begin to see that the same things are going. I love to see the students' critical thinking change. I love to see their problem-solving abilities. And I'm always blessed that the students' evaluations of the course and are above the college mean.
Yes, that's good to have those. Good to have good student evaluations. And so what we learned from using multimedia case study in the course on the nursing care of the older adult is that, yes, students do get engrossed in the story as it develops. And each week they anticipate what's going to happen next week. Students like to investigate, analyze, put things together, suggest solutions, suggest alternative treatments, alternative ways of doing things for Mrs. Stone. They really get motivated to work harder for their patient. Multimedia elements, even when they are kept at a very simple level, do visualize and personalize the context and the characters. Creating multimedia elements does not require expensive technology at all. We used only resources already available to us, personal digital devices, and the camcorder that we have here on premises at the College of Nursing. Didn't buy anything, didn't spend any money on development. Collaborate with colleagues, ID and IT professionals. ID is instructional design. IT, everybody knows information technology. So collaborate with those folks and use all available ideas. Low stakes assessments, remember how those participation activities are graded just for participation, full credit for just doing the job. Work very well, very well. It's a great motivational tool, and it enables practicing the tasks that students might not be able to do in the classroom or even in the field study. So using testing and survey features in your learning management system in Blackboard to collect student responses allows you to see individual performance and results in the aggregated format. So you can quickly see where the class is going with a particular task, and then, you know, base your video response to students on that. And of course, without the timely and thoughtful, encouraging feedback from students, this will crumble apart and not lead to good outcomes. So timely feedback from the instructor is critical. And so we are checking in on the chat again. So any questions, comments? So we have a question. Do you incorporate, make available any job aids, task lists, or other tools? Yes, yes, we do provide professional instruments with which nurses work. This is what makes this study so authentic. So anything professional, any professional tool that you can incorporate will strongly enhance the learning experience. And where students find these resources, we include them in the Word document for case study episodes. So that's why we chose to use the Word documents, just because it's so easy to say, go to this URL, pull up this tool, use it to assess your patient. And there's our references. We wrote an article about this experience, and it's based on what these other 3 sources recommend. Everything worked out for us. This worked very well for us, and we hope that you will be able to identify the elements that you can do. Our case study is centered around the patient, but it doesn't have to be. It can be anything. You can set up your case study as a day on the job, or a day or in the biology lab, and then have students do something in that biology lab every week. And if you write it as a continuing story, yes, the students will get into it, just like we all enjoy our soap operas or continuing shows, following the story and identifying with the characters. So if you would like to brainstorm with us, you can see our contact information is provided, and we'll be happy to carry this dialogue with you after the workshop is over.